didn't have the surgery, I wouldn't be here. I'd be dead.
We're back out at TSAOG Orthopaedics today to talk about a life-changing procedure. Dr. Adewale Adeniran is with us now. Now, the condition that we're talking about is cervical myelopathy. Now, what is that?
Cervical myelopathy is when the spinal cord, which runs here in your neck, when the spinal cord is being compressed for any of a number of reasons. Most commonly, it's a consequence of arthritis in your neck, which narrows the space for the spinal canal and can squeeze the spinal cord and damage it.
So what are the signs and symptoms of that condition?
Some of the early signs are gait disturbance. People feel a lack of balance. They start to fall. Some of them just stumble. And then loss of fine motor movements of your hands or of your legs even. People have trouble buttoning buttons, trouble tying shoes. And then some people will also have increasing problems with bowel and bladder control. They don't know when they need to go.
How does this get treated? Like, what do you have to do to fix this?
Cervical myelopathy is one of those conditions, in one of the few conditions in spine surgery where if you see it, for almost everybody, the recommendation is spine surgery. The reason is that the spinal cord is being squeezed basically to death, and if you harm the spinal cord in that way, you sometimes get irreversible changes, and so it's really usually a good idea to take the pressure off it as soon as you can in hopes that the patient gets better.
What does the procedure involve? How invasive is that?
There are many different types of procedures depending on the details of what's compressing the spinal cord, and most of the time you're able to do a fairly minimally invasive procedure. It's called an anterior cervical discectomy infusion. Most of the time people have cervical myelopathy from just one level. That surgery takes about an hour. The incision's about 2 inches long, and most people do well from it. They go home the next day or the day after usually.
I mean, an hour? That's not that long at all. So, I mean, that's a pretty quick turnaround on the procedure.
It is, especially for a condition that is potentially so life-altering. It's something that usually when you see it, you don't hesitate to tell people that it's the right thing for them to do.
So what are the results you're seeing in the patients that receive this procedure?
The results are very variable. Cervical myelopathy is frequently a progressive condition. People get worse and worse. They lose more and more function the longer you wait. We consider surgery a clinical success if you can arrest that process, if you can stop them from getting worse. Thankfully, very many people recover some of the function they've lost after surgery, but it's hard to really predict how much somebody's going to get back from cervical myelopathy surgery.
Now, is there a patient that we can speak to today that went through the procedure?
Yeah, we have a patient here. His name is Joseph Glavin. He had a single-level anterior cervical discectomy infusion. We can go talk to him.
Okay, great. Let's go talk to him. So, Mr. Glavin, what signs and symptoms did you experience that made you want to come here and get help from TSAOG?
Well, first of all, my hands were starting to feel numb, and my legs, my feet particularly, were starting to feel numb. The thing about when I fell came on so suddenly. That's the part that I just didn't understand.
What was the kind of treatment that you received here?
My daughter, Katrina, she went, and when she came back, she said, "Dad, this is the man that's going to save your life." And so I said, we talked for about 2 hours, and finally we went to the hospital, and he operated on me. And the following day, I was standing up.
What differences have you seen in your dad since the treatment?
This is wonderful because he's now back playing cards with all of his friends. He can go on field trips. He does his own laundry. He dresses himself. He takes care of himself. He doesn't need anybody to help him do any of those kind of things. That's the best part.
Dr. Adeniran, thank you so much for having us out here today. And to get more information on TSAOG Orthopaedics, you can call 210-804-5400 or visit tsaog.com.